Hello everyone from WHO headquarters here in Geneva. Welcome to a regular press conference regarding the situation with COVID-19. Today we will have a special guests as we have announced in the media advisory, and Dr. Tedros will introduce them. We also have Dr. Maria Van Kerkhove and Dr. Mike Ryan. We have, as we had in previous days, simultaneous interpretation in 6 UN languages plus Portuguese, and I will thank the interpreters who are here with us. Also, we have sent you a number of press releases today, so hope you got those, and some of them are about the topics that we will hear about today. So before we go to questions, Dr. Tedros will have a remarks, and he will also introduce our guests. Dr. Tedros.
Thank you, Tariq. Good morning, good afternoon, and good evening. 3 months ago, I convened the emergency committee under the international health regulations, and after receiving their advice, I declared a global health emergency, WHO's highest level of alarm, on January 30th. And yesterday, I reconvened the emergency committee to review the evolution of the pandemic and advise me accordingly. After 3 months, the committee consists of independent international experts representing all regions and full range of relevant expertise. I would like to thank the chair of the committee, Professor Didier Hussong, and all the committee members. Of course, the pandemic remains a public health emergency of international concern. The committee has made several recommendations for WHO and for countries. To outline those recommendations, I would now like to invite Professor Hussong to say a few words. Professor, you have the floor.
The international health regulations, the emergency committee met yesterday, 3 months after the declaration of a fake by the DG of WHO. First, let me thank also the members of the EC, which met yesterday during 6 hours. They listened first to the analysis of the situation by the emergency directors of the 6 regions of WHO and by the Secretariat, which has a global view of the situation. Clearly, a huge amount of work has been done at WHO at all levels and by member states to try to face this pandemic. Clearly, also, there are differences between regions. In some regions, the impact of the disease is very severe. In some others, it is less severe. Many things have been accomplished, but challenges are still present, and challenges are huge. After 3 months, the EC members were first asked to state whether this terrible event is still a public health emergency of international concern. And as you said, Dr. Tedros, the answer was quite simple. It is clear, the advice to the DG was clear. Yes, COVID-19 is still a public health emergency of international concern. COVID-19 pandemic is not finished. EC members were then asked to study advices formulated in January. Should these recommendations be abandoned? Should they be modified? Should they be completed? And 2 categories of advices were issued by the committee, which I would like to very briefly not review, but just to identify some of the most important ones. More than 20 recommendations were addressed to WHO, and I would like to focus on 4 of them. The increased efforts towards fragile states and vulnerable countries, and to mitigate possible disruption of food supply in some countries. Interruption of travel, of air travel, in some cases, is a big handicap to cargo transportation, and this is why this is a risk which needs to be addressed. Second, to develop strategic guidance with partners for a safe return to normal operation of passenger travel. This is a difficult issue because it's a question of confidence between member states. It's a question of safe travel, but it's also a very important aspect for the activities in many countries which are relying very much on air travel. The third one is to revise recommendations on appropriate travel measures and to analyze their effect on COVID-19 transmission with consideration, this is a very important point, to the balance between benefit and unintended consequences. Then we addressed also a series of recommendations, also more than 20, to the member states. And I would like to focus very briefly on 3 of them. First, to support WHO leadership. We have only one WHO, and we are in the middle of a pandemic. Second, to work with WHO and multi-sectoral partners to interrupt virus transmission using all the techniques and methods which can be used, considering, of course, the unintended consequences which can arise in some circumstances. And finally, I think it's very important to address the knowledge gaps with regard to research. We know too little about the transmission of the virus. We have at the moment nothing for prevention with vaccine, and we have at the moment no licensed therapeutics. This should change. Thank you very much.
Thank you very much, Professor Didier Houssin, for these remarks. I will give the floor again to Dr. Tedros.
Thank you, Professor Houssin. I would like to make a few remarks about the committee's advice for WHO. We appreciate the confidence and trust expressed by the committee in WHO to continue to lead and coordinate the global response to the pandemic in collaboration with countries and partners. We're committed to fulfilling that role and to accelerating our efforts. WHO will continue supporting all countries with technical and logistical support, especially those that need it most. We accept the committee's advice that WHO works to identify the animal source of the virus through international scientific and collaborative missions in collaboration with the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations. We will continue supporting countries to sustain essential health services, including vaccination, care for women during pregnancy and childbirth, and care for non-communicable diseases, including mental health conditions. As we have done clearly from the beginning, we will continue to call on countries to implement a comprehensive package of measures to find, isolate, test, and treat every case and trace every contact. We will continue working with countries and partners to enable essential travel needed for pandemic response, humanitarian relief, and cargo operations, and for countries to gradually resume normal passenger travel. As Professor Houssin explained, the committee has also made recommendations for countries, and we encourage countries to pay careful attention to that advice. And we encourage countries to follow WHO's advice, which we're constantly reviewing and updating as we learn more about the virus and as we learn more from countries about best practices for responding to it. In accordance with the international health regulations, I will reconvene the emergency committee again in 90 days or sooner if needed. As you remember, last Friday we joined the European Commission and other partners to launch the ACT Accelerator to ensure all people enjoy access to all the tools to prevent, detect, and treat COVID-19. This coming Monday, May 4, the Commission will host a pledging conference to generate funds for investment in vaccine research. I hope you have heard the call from the President of the European Commission, President Ursula von der Leyen. Today, we're deepening our relationship with the European Union by signing a new Memorandum of Understanding with the European Investment Bank, EIB. This agreement covers 5 main areas of work. First, WHO and European Investment Bank will collaborate on a new European Union malaria fund to address market failures in developing more effective vaccines, drugs, and diagnostics for malaria. Although malaria deaths have fallen by more than half since the year 2000, progress has stalled in recent years and may even reverse if the COVID-19 pandemic disrupts malaria control programs. Last year, WHO Strategic Advisory Group on Malaria Eradication and the Lancet Commission on Malaria Eradication both concluded that we will need new tools if we're to achieve the dream of eradicating malaria. Both reports called for increased investment in research and development to deliver new tools. With WHO's technical expertise and the European Investment Bank's financial muscle, we're confident of accelerating the development of those new tools. Second, our 2 organizations will work together to foster the development of new innovative antibacterial treatments. Antibiotic resistance is one of the most urgent health challenges of our time. It threatens to unravel a century of medical progress and leave us defenseless against infections that were previously easily treated. Investment in antibiotic development has continued to decline. Some small antibiotic companies went bankrupt in 2019 because of the limited profitability of the new antibiotics. Very few new antibiotics are in the pipeline. Most of them offer little benefit over existing treatments, and very few target the most critical resistant bacteria. To address this challenge, WHO and the European Investment Bank are working on a fund to invest in the development of new antibiotics for priority pathogens. WHO and EIB now are in discussions with potential investors and other stakeholders on this initiative. Third, we will work together to strengthen primary health care and build resilient health systems. The COVID-19 crisis has illustrated that even the most sophisticated health systems have struggled to cope with the pandemic. WHO has grave concerns about the potential impact the virus could have as it starts to accelerate in countries with weaker health systems. With the EIB, we will therefore work urgently to invest in health infrastructure and health workers in 10 countries in Africa and the Middle East to start with. Fourth, EIB and WHO are exploring how the European Investment Bank could support the COVID-19 supply chain system to facilitate the distribution of diagnostics, personal protective equipment, and other medical supplies to countries that need them most. And fifth, we will work together to study market failures in other areas of public health to examine how innovative financing could help overcome investment barriers and increase access to life-saving products and services. The EIB has rich experience in innovative financing. I learned from my friend Werner Hoye today that the EIB were pioneers of the so-called green bonds 30 years ago to generate funds for climate and environmental projects, billions of dollars. We look forward to seeing how that type of innovative financing could deliver real results for global health when WHO is advocating health for all. As you know, we have been saying all roads should lead to universal health coverage. And it's not actually more important than now ever during COVID pandemics to say exactly the same. All roads should lead to universal health coverage, health for all. WHO is deeply grateful to the European Investment Bank for its support and collaboration. I would now like to invite the President of the European Investment Bank, Mr. Werner Hoye, to say a few words. Vielen Dank, my friend, and you have the floor.
Thank you very much. Merci beaucoup, Dr. Tedros. It's a great pleasure and honor to be with you today. Around the world, the COVID-19 pandemic is leaving a global trail of health, social, and economic destruction that is unprecedented in peacetime since the Great Depression of the 1930s. So the coronavirus pandemic has exposed weaknesses in many health and economic systems, and it has also shown vulnerabilities in the global community's ability to prevent and to respond to pandemic threats. Facing such a global challenge, the response needs to be coordinated, it needs to be bold, it needs to be quick, and it needs to be reactive to a changing environment. I would like to thank WHO and Dr. Tedros in particular for their leadership and for their tireless efforts. As the EU Bank, we are fully committed to strengthening the European Union's global response. And as the largest multilateral investment bank in the world by assets, we believe that we have a responsibility to act and can play an important role in the global response. Cooperation with WHO is formalized today with the signature of this agreement. But our teams have been working on the ground together and learning from each other, implementing health projects for some time now. Indeed, in recent years, the EU Bank has provided more than $2.3 billion annually for healthcare and life science investments across Europe and the world. Since the pandemic was declared, the European Investment Bank has transformed its support for health and business investment to help tackle new challenges. European heads of state and government have recently called on the EIB to support 200 billion of new financing for the European economy as part of the joint EU response. Outside the European Union, we have committed to provide 1/3 of the EU response, that is 5.2 billion for COVID-19 related health and business investment needs following discussions with partners across 100 countries. On Monday afternoon, Dr. Tedros already mentioned it, we will together participate in the pledging conference bringing together the European Union, G20 and UN partners to step up research, investment in vaccine research. As part of the pledging conference, I will outline how the EIB is currently assessing more than 20 vaccine development, diagnostic and treatment projects, which could provide up to 700 million euros of new investment. So, ladies and gentlemen, my colleagues and I are pleased that today the EIB can step up our long-standing cooperation with the World Health Organization at this time of need. And it fits perfectly into our cooperation with the United Nations Organization in general and its sub-organizations. Our new partnership combines the WHO's unparalleled global health expertise and the EIB's financial strength and creativity. It will help deploy innovative financing solutions for high-impact health investment and successful life science research and development. And this is exactly the international coordination needed to handle global health challenges. It comes at a time of need, but we look at the longer term and at a wide spectrum of activities and projects. As confirmed by Dr. Tedros, this new agreement will allow the EIB and the WHO to support the up to 250 million euro EU malaria fund, where we cooperate so closely also with the European Union, represented by the Commission and the Bill and Melinda Gates Foundation. It will bring together public and private partners to develop and deliver more active malaria treatment at a time when ongoing research efforts are threatened by COVID-19. The EU Bank has a successful track record of overcoming investment gaps across priority sectors. Market failures continue to prevent improvement of health globally. The EIB addresses these failures by crowding in and mobilizing finance to projects responding to societal needs. I think this is the key issue. We need to mobilize also private sector financing in order to reach our objectives. When we, Dr. Tedros just referred to it, invented the green bonds 13 years ago as the first issue of green bonds, the bank was considered lunatic. Now this market is more than $900 billion heavy, and it's a big success. And in my talks with the Secretary General of the United Nations, I promised that we would explore these possibilities, which we have explored with green bonds, also for other sustainable development goals, health and education being one of the key sectors there. Together with WHO, the EIB will not only accelerate investment in national public health systems, but also focus support of addressing antimicrobial resistance alongside malaria. It is essential that new investment successfully addresses the risk that current antimicrobial treatment will no longer be effective. We estimate that at least 1 billion euros is needed to provide medium-term solutions to antimicrobial resistance. Today's agreement will enable the EU Bank, the WHO, and new partners to accelerate work on a financing initiative, the new one. This will support development of novel antimicrobials and address the investment gap. And we are seeing on a daily basis investment to strengthen resilience to pandemics and public health emergencies. And this is essential to save lives and protect economic activity. So we will be able to support vulnerable countries around the world, which are facing huge pressures on limited health infrastructure, and enable them to better tackle the impact of COVID-19. In the coming weeks, the EIB and WHO, alongside other UN partners, will strengthen public health preparedness by supporting new health investment, starting with 10 countries across Africa. Indeed, as part of Team Europe, we have committed to supporting 1.4 billion euros to new COVID-19 financing in sub-Saharan Africa. Our combined efforts in the coming months and years will strengthen the value of the work of the UN supply chain systems, improving the provision of equipment, will accelerate investment in primary healthcare and pandemic preparedness. This will include increasing investment in health workers and improving water and sanitation infrastructure. And together as an international community, we need to step up investments in global health and resilience. I believe the aforementioned is an important step. Let me thank all those involved in making today's agreement with the WHO possible. Dr. Tedros, thanks to you and your collaborators on this great initiative. I know that there are much more important issues to discuss today, as we have just heard, but if there are any questions on our activities, I'm ready to respond.
Thank you very much, Mr. Hoyer, for your remarks, and thank you also for agreeing to stay with us for possible questions that may come from journalists. Dr. Tedros will now formalize this agreement by signing the Memorandum of Understanding between the World Health Organization and European Investment Bank.
Okay, thank you. Thank you, my friend Werner, and I have the MOU with me. So Mr. Hoyer had already signed, so it's an honor for me to sign. Thank you. So that's it, signed. And thank you so much to the European Investment Bank for its support, and especially to my friend, Mr. Werner Foye. Thank you so much. Together, we will
Thank you so much.
Thank you. Thank you. Phil and
We'll get it done.